Okay, welcome everyone. We still have a minute or two from my clock, so I'm just going to continue to take a few moments to let the majority of the people in. Thank you so much for joining us today, and just give us a minute or so, and then we will be getting started.
Okay. Let's see,
Welcome everyone. Thank you for joining us. Just give me a moment to let the last few attendees that I see come in, and then I will get you started. Okay, I don't know about everyone else, but my clock says 1 o'clock, so I am going to get started. My name is Latrice Preston, and I am the strategic business partner for ICUBA. I just appreciate you all joining us today for this well-being webinar with ICUBAcares. Our speaker today will be Stephanie Michaels with ICUBAcares, and she is going to get started. Unfortunately, we don't have Stephanie's camera working in our favor today, but you will have all the information that you need, and I'm sure she can hear everybody just fine with regard to questions. If you do have questions, please feel free to enter the chat. I will be happy to relay those questions directly to Stephanie, and we will get as many questions answered as we possibly can. With that being said, I will go ahead and turn it over to Stephanie, and we will get started.
Thank you so much, Latrice. Good afternoon, everybody. My name is Stephanie. I am one of the pharmacists here, part of the ICUBAcares team, and I am really looking forward to taking a little bit of time with you guys today to talk about ICUBAcares, who we are, what we do, and how we can hopefully help you. Latrice has handled a lot of the housekeeping tasks already, so as she mentioned, if you do have questions, feel free to drop them in the chat. The only thing that I have to add on top of that is try to keep your questions more general in nature. If you do have specific questions as it relates to your individual situation or prescriptions, we are more than happy to help you with that. But in order to protect your own health privacy, that would need to be done one-on-one, not over the webinar. So just keep those questions general, and let's go ahead and get started. I think the best place to start is, who are we? Who is ICUBAcares? So I like to describe it, we are your ICUBA pharmacists. We are a team of pharmacists here to support you, all ICUBA members, in managing your pharmacy benefits. Our goal is to make sure that all of our members always receive the most appropriate and the most cost-effective therapy. And we are really proud to serve you in 3 main roles. The first role that we serve is we are here to be your advocate. We are here to listen very closely to any questions, concerns, or issues that may arise as it relates to your prescriptions and pharmacy benefits. And we will use our knowledge of both drug therapy as well as our knowledge of our ICUBA formulary and pharmacy benefits in order to find solutions for you. The second role that we serve is that we are here to be your liaison. We will listen to you and communicate with you, as well as your individual provider, your pharmacies, our health plans. So that could be OptumRx, Blue Cross Blue Shield, sometimes ICUBA management, whoever we need to communicate with in order to get your problems addressed and resolved for you. And above all, we are pharmacists. So we are here to answer any drug-related information or drug-related questions that you may have. And we are here. We are available and easy to reach for you guys. I know that sometimes it helps to put faces to names. So these are the four main pharmacists, part of the ICUBAcares team. We have Gore Alvarez, David Pino, Nellie Simpkins-Zeltzman, and myself, Stephanie Michaels. We do have some other support staff that does help us out, but these are our four main pharmacists that you'd probably be reaching. So here at ICUBAcares, we operate under four main pillars. Most of the services that we provide for you will fall into one of these four categories, which include prior authorization assistance, medication therapy management, formulary management, and medication adherence. And we are going to take a look at each of these pillars individually. Okay, so our first pillar is prior authorization assistance. Before I go ahead and talk about this, I just want to take a moment to quickly define what a prior authorization is for those of you who might not be aware. A prior authorization is when a service, so in this case, the service or product would be your prescription, requires additional documentation or explanation from the provider before it is covered on the plan. And a prior authorization is something that, in theory, should be relatively straightforward and easy, but in reality, often is a little more time consuming and a little more frustrating than it probably should be. But that's okay because that's why we're here. So, how can we help you with this? Well, if you show up at the pharmacy and you're told that your prescription needs a prior authorization, you can feel free to call us. We will explain the steps to you and detail what is needed from you, what is needed from your provider. Just one second, I have a pop-up box there. Okay. We will detail what is needed from you, what is needed from your doctor, and we can also outline the approval criteria for the specific medication. So we can kind of sometimes tell ahead of time if maybe you qualify for this particular medication and it's worth pursuing the prior authorization, or maybe you're really far from meeting criteria, and then we could just jump in and help you with alternatives. So not only will we explain the process to you, but we will kind of take the lead and take the burden off of your shoulders. We're here to do all of the communicating to all different parties in the process. So we will coordinate information between you, your pharmacy, your doctor's office, OptumRx, Blue Cross Blue Shield, whichever player is the component of the chain, so to speak, that has the next action step needed. So this will save you a lot of time, a lot of phone calls, and a lot of confusion. And above all, we will give you regular status updates. We will follow up with all parties involved. If we need to follow up with your doctor's office, we will do that. If we need to follow up with the health insurance plan to see where things are in the process, we will do that. Our goal is to keep things moving as efficiently as possible and to always keep you in the loop. We never want you to feel confused as to where your medication is in the process or what the next step is. So throughout the presentation, I did include some of these did you know moments because my goal here is that you do leave today knowing a little bit more than what you came here with. So I do hope that you learned something extra about our pharmacy benefits. And what I have here is that a lot of times prior authorizations are marked as denied when in fact these are not true denials. They're more of what I would call incomplete, but they are marked as denied just because there's a lack of supporting documentation, maybe follow up from your provider or incomplete clinical notes. Now, this is 100% not to put the blame on your provider. We are not saying that they are lazy or not doing their jobs. Actually, quite the opposite. They work tirelessly to provide you with the best care possible. They're but a lot of paperwork is required in this. And like many of us, your doctor's offices are overworked, understaffed, and they just don't have time all day to be paper pushers. And unfortunately, some things will slip through the cracks through no fault of their own, but we are here to make sure that that doesn't happen to our members. We don't want you slipping through the cracks. We don't want things getting marked as denials when really just a little bit more information is needed. So I did go ahead and include a bit of a graphic representation of what happens. Let's say you go to the doctor, you're diagnosed with a new condition, and they send a prescription over to your pharmacy. The prescription will arrive to the pharmacy. Usually these days that's electronically, and it will alert the pharmacy team, hey, this isn't covered, it needs a prior authorization. The pharmacy will then go ahead and usually electronically notify the doctor's office that a prior authorization is needed. Now, in an ideal scenario, the doctor's office would send whatever records are needed over to the insurance, and the insurance would review it and either approve or deny it. But these last two steps here are where we tend to go in circles many, many times. Sometimes the doctor's office is not 100% clear on what needs to be sent. Do they want lab work? Do they want a list of medications that you've tried and failed in the past? Do they want clinical notes? 3 months of clinical notes, 6 months of clinical notes? What exactly do they need to send? So then they'll send what they think they need. The insurance will kick it back. Hey, we need more information. And then what happens there? There's so many different scenarios on what could happen. But as you can see, this is where we can go in loops over and over and over and over. And ultimately, it's really just affecting you getting your medication. So this is where we are more than happy to jump in, reach out to your doctor's office and say, hey, here's a fax. Please fax to this number. 6 months of clinical notes for Jane Smith. Please, can you provide a list of the medications for her migraines that she's tried and failed in the past? Please can you include, her most recent blood work? And then we will then make sure that they send it. We will be that friendly little tap on their shoulder to make sure that, it is followed through with and sent over to the plan. And we will also make sure that the plan reviews it and processes it in a timely fashion for you. So that's a really good way where we can jump in and make sure that things move efficiently. All right, so some more did you knows. Did you know that if you experience trouble getting a medication, you always have options? And what a lot of people know, maybe not everyone, is that if a prior authorization is denied, your doctor can go ahead and appeal that decision. But what some people don't know is that you also have the right as the patient to self appeal. You always have the right to appeal and advocate on behalf of yourself and to file a self appeal. And we're more than happy to explain that process to you. Also, I will say 9 times out of 10, if a medication is denied, there's usually covered formulary alternatives. Sometimes it's in the same drug class, sometimes it's a cousin product, so to speak, but usually there are options, and we are here to help you identify what the therapeutic alternatives are that are covered instead. And if you do choose to pay for a medication out of pocket, you can always use funds from your HRA or FSA card to help pay for the medication. And you also have the option of using discount cards or manufacturer copay cards. So discount cards would be things like a GoodRx coupon or any of those generic savings cards that you might get in the mail or online. Manufacturer copay cards would be coupons directly from the manufacturer, directly from their website. And if you do use a manufacturer copay card or a GoodRx, you can't use them both, but if you use um, one or the other, you can use your HRA or FSA funds on top of that. So there is a way to kind of play the game and try to maximize your savings. Okay, so this brings us into our second pillar, which is medication therapy management. And medication therapy management is an umbrella term for us helping you to optimize the medication you take and how you take it in order to improve your health. And there's a couple different services that we do under the umbrella of medication therapy management. One of the main ways we do this is through what we call our medication checkups. And this is when we will call you to review your medications with you and discuss all of them, all of your prescriptions, over the counter products, and supplements. And this call has two purposes. The primary purpose would be we are looking to identify interactions, duplications of therapy, omissions in therapy, side effects that you may be experiencing. The second purpose is it's a really good opportunity for us to connect with you and see if there's any problems or barriers that you're experiencing. So that could range from anything like your medication is just too expensive, or why is your medication more this month than it was last month? Maybe you're having trouble finding the medication. Maybe it's unavailable for your pharmacy to order and it's on a manufacturer back order. Maybe you're just overwhelmed with how many medications you're taking, and you didn't realize that there's a weekly option for this, or there's a combination pill available for this instead. So it's a really good moment for us to connect with you and see if you need any type of assistance whatsoever. So, 2 points to make in addition regarding these medication checkups. A lot of people will say, oh, I don't need to do this. I do it at my doctor's office. So, the first point is that you absolutely don't have to engage in the conversation if you don't want to. If you're not interested, that is perfectly fine. Just say you prefer, not to do this service, and that is fine. But the second point that I want to remind you is that many people see multiple doctors and multiple providers. You might have a primary care doctor as well as a cardiologist, an endocrinologist, all different types of specialists. And sometimes our system can be very fragmented in that one doctor might not know what another doctor is prescribing you. And these medication checkups allow us to look at everything from a more comprehensive stance and look at everything as a whole to make sure that there's no problems. We're also able to take a little more time than unfortunately your doctor is allotted during those office visits just to go over your prescriptions and make sure that there's no issues. Another thing that we do both during these calls and just during other calls that we do is we provide medication education. So this could look like guiding you on how to use your medications. And some of you might be thinking, what do you mean how to use my medication? It's a pill, I take my pill and that's that. And sometimes it is that easy, but as we move forward, technology is increasing and a lot of things are a little more complicated than before. We have a lot of different delivery systems. We have injectables and biologic products and refrigerated items and things, patches that we wear, and all different types of delivery systems. So we are here to answer questions. What do I do if my medicated patch is breaking me out in a rash every time that I wear it? What do I do if my refrigerated product was left out of the refrigerator for 2 weeks? Or, my insulin pen stopped working. What do I do? So, all different issues like that do come up. We are here to provide any guidance and education that you may need. So my next did you know, and the reason that I included this at this point in the presentation is because this is something that when we do these medication checkups, this is a common thing that we do identify with members. Did you know that our plan covers continuous glucose monitors for most of our diabetic members using insulin? So if you are an ICUBA member and you are diabetic and you are on insulin, most likely you qualify for a continuous glucose monitor, which is what you see here in the picture. It's the wearable monitor so that you don't have to prick yourself daily in order to check your glucose. The Dexcom is the brand that's currently covered on our plan, but if you use insulin, you most likely do qualify for one of these. For our diabetic members who are not insulin users, one-touch testing supplies are covered at no charge with a prescription. So my hope is that every single diabetic member watching this is not paying out of pocket for any type of testing supplies. All right, so this brings us into our third pillar, which is formulary management assistance. So, our drug formulary is a list of covered medications and excluded medications. It is broken down into what we call tiers. Different drugs are assigned to different tiers, and our copay structure applies to everything based on the tier that it falls under. We're here to help you navigate that. If you're not sure what falls under a certain tier, what the tiers mean, what the copays mean, we can help you with that. We can clarify any unfamiliar terminology, even if you think you know, because a lot of times everything is abbreviated, it adds another layer of confusion. So you might look at the formulary and see things such as ST for step therapy, QL for quantity limits, all different types of terms and abbreviations that we can help decipher for you. And we can always help identify covered alternatives for any products on our formulary that are excluded. So our formulary can change throughout the planned year. It usually doesn't change much, but it can change throughout the year. And something really great that ICUBA lets us do is outreach members in advance, weeks prior to these formulary changes, if you are impacted. And this allows us to explain any changes, why these changes are happening, and offer alternatives proactively. That way, if we do need to reach out to your doctor, this can be done in advance, so you're not kind of struggling last minute to get this resolved. And I can tell you just from working at many other places in the past that this is such a nice service. What it really does look like on most plans is that they will send you a letter in the mail if something is changing. If you happen to see the letter, great. If you don't happen to see that letter, you show up at the pharmacy expecting the prescription that you've always gotten to be ready. The pharmacy tells you it's no longer covered, and you are just out of luck. You're just out of luck, scrambling to make sense of this all at the last moment. So it really is very member centric of ICUBA that we are able to outreach you guys ahead of time to work through any solutions proactively. And another cool feature that we have is we have partnered with RxSS, which stands for Prescription Savings Solutions. And this is just another feature that we have to make saving some money on your prescriptions a little bit more effortless. So I realized that I probably should have switched these first two steps because I think that downloading the app is probably the first step in the process. And then once you download the app, you can go ahead and register for RxSS. But what it will do is it will pull you up as an individual. So it will pull up your medication profile and automatically identify different ways in which you can save money. And this is all cross-checked against our formulary. So you know that whatever opportunities RxSS is offering, it makes sense. It's based off of our formulary. We do encourage you to call us if you have any questions regarding these changes that the app is suggesting for you. It is an app, so therefore it's a computer. And while a lot of these recommendations might make sense financially, they don't always make sense clinically. So go ahead and give us a call, and we're happy to take a look at the recommendations that the app is making just to see if these are actually clinically sound recommendations before you go ahead and reach out to your doctor to maybe discuss switching medications. We'll also reach out to you periodically. We do get a list of these opportunities, and if we identify cost savings opportunities through RxSS that make really good financial savings for you and make really good clinically sound sense, we will reach out to you periodically to discuss these opportunities with you.
Stephanie,
Yes.
when you do the outreach on the
Mhm,
telephone, does
mhm.
that show up as ICUBAcares calling? Do you know?
Oh, that's such a good question, Latrice. It's supposed to, and we have gone through this many times to resolve it because for a while it was not showing up as IQUBA Cares. I have noticed more and more that it is, but I think it really depends on your carrier. So
Okay.
I tested it with myself the other day, and it did show ICUBAcares on my cell phone. I do have members that are saying that it's still not showing. I do have a slide a little bit down in the presentation, basically just save our number to your phone because we are an 877 number, and for some members, it doesn't show up as ICUBAcares.
Okay. I do have a couple of questions. One says, is the COVID vaccine covered?
Yes, the COVID vaccine is covered under the insurance. However, availability, especially availability as far as getting it at a pharmacy, is still very up in the air, waiting on the final recommendation from the CDC. So last week, the ACIP voted to not require a prescription on the COVID vaccine and to basically leave it up to shared clinical decision making between a patient and their provider, and a pharmacist at the pharmacy can serve as that provider. But now the CDC has to formally adopt that recommendation before most pharmacies will administer. But yes, it is covered.
Okay, they said I called the insurance and I'm assuming that it's saying they say COVID was not covered. To
So
clarify, are you saying that Blue Cross Blue Shield said that it was not covered? Yes, they're saying Blue Cross Blue Shield said it was not covered.
now, I will look into this a little further, but it's covered under pharmacy benefits. So it's going to go through Optum RX, which is our pharmacy benefits. And I have seen many claims go through for no charge. I've run many test claims myself, and they've all gone through for no charge. I'm happy if you want to leave your contact information to, quadruple check that for you. But to my knowledge, the COVID vaccine should be covered under pharmacy for no charge.
She's saying, do you need a prescription?
So, according to the ACIP's vote last week, you will not need a prescription for it.
Okay.
Just due to the current, environment with everything, we are still waiting on a final vote from the CDC where they will actually update the guidelines. Last Friday was more of a recommendation. Now the CDC has to adopt that recommendation.
Okay, so for this member, I do have your information in the chat. So we'll definitely get back with you on an individual basis.
Yes.
Where do you go to register for RXS?
So it's an app. So you can download the app on your phone from the App Store, and it should be listed as RxSS, RX Savings Solutions,
Okay,
but it is an app.
perfect. Okay, that is it for now. Thank
Oh,
you.
yeah, awesome.
I have a
Mhm.
question, please.
Sure. Sure.
I have the Dexcom, and
Okay.
it's an older version, the one that you have to keep it on your stomach. And
Mhm.
my doctor tried to get me to the new version several months back, and it came back saying that I needed to pay like a whole large copay, which I said, I can't afford that. So I
Okay.
was wondering what went wrong there.
Okay.
Okay, so
So,
I've got your personal information. We'll have Stephanie reach back out to you directly as well.
Okay, thank
I'm
you.
sorry to cut you off, Stephanie. Yes, but I know that there are some people who did join actually a little bit after we did intros. If there's something on a personal level that you would like addressed, if it's any way possible for you to enter the chat and just give me your question, then those ones we'll give directly to Stephanie and we'll handle that way. That way we can make sure that a lot of your personal information isn't going out to the group.
right, absolutely. We'll definitely reach back out to you. So, I will get back to you shortly on that and take a look at what was going on. Thank you, Latrice.
Sure. I do
Uh,
have another question.
sure.
Type 1 diabetic GLP-1 med that is helping with blood sugar and A1C. Why are these drugs being taken away?
Yeah, so that's a tough one, and the main answer to that is that these medications are very expensive, and a lot of members are using them. And the plan had to make a decision due to the sheer volume and the sheer cost of the GLP-1s. In order for coverage to continue, everybody's premiums would have had to go up substantially. And it's definitely not something that, we're happy about, but as insurance goes, we have to the plan has to look at everybody as a whole and our premiums as a whole. And in order to continue coverage, premiums would have had to increase substantially.
And I do have your information as well, so I will be more than happy to reach out and give you information with regards to additional information on that particular change. But what Stephanie is saying is spot on. I know it can be problematic for those who are type 1 diabetic, but we will be happy to address your questions and your concerns directly. So I will be in touch directly with you in order to have that conversation.
Yeah, definitely. And I do have, I'd be more than happy to chat with you as well. I do have a couple extra thoughts, but that is the gist of it. So thank you again, Latrice. And
No
if there's
problem.
no other questions at the moment, so we'll just move on. A couple more did you know points here regarding our plan structure that I definitely want all members here to be aware of. For most medications on our formulary, so not all, but most, you do have the benefit of extra value when you fill your prescription for a 3-month supply as opposed to a 1 or 2 month supply. You're only going to be charged 2 copays for a 3-month supply. So what I mean by that is if I'm on a medication and I fill a 1 month supply and my copay is $10, I pay $10. If I fill a 2 month supply, I'm going to be charged $20. If I fill a 3 month supply, I'm still only going to be charged $20. So that's a really good way to help maximize savings and value for most medications that qualify. And we can definitely answer questions for you regarding which medications fall into that bucket versus which ones do not. Another thing, you can always reach out to us if you are on an expensive medication. We're more than happy to check to see if there's any manufacturer savings programs or copay cards available to help bring your copay down. And we are here to answer questions regarding out of pocket changes. So, sometimes, once in a while, depending on your prescription, the price you pay for it 1 month can change the next month. And this could be due to your out of pocket max maybe not being met or various factors. And you can always reach out to us, and we're happy to look into it and to explain to you why that is the case. Oh, sorry, I think I went way too ahead there. Okay. Another did you know moment, and I think hopefully you all do know this by now because I did just say it, but our plan does update the formulary periodically, and we do reach out to you in advance for any changes. One point I want to clarify, I know a lot of members are confused about sometimes, is OptumRx. OptumRx is our pharmacy benefits manager. We are not OptumRx. We work very closely with them and we have a lot of wonderful contacts over at OptumRx that we can reach out to help things move more efficiently for you. But ICUBAcares is a separate entity than OptumRx. And I like to explain this as OptumRx is there to support the ICUBA plan in managing and executing benefits. ICUBAcares is here to support you as an individual. So to provide that extra layer of service to you guys as an individual. And our last pillar is medication adherence assistance. So this is us making sure that you are empowered to not only take your medications, but to take them consistently. And there's a few different ways that we do this. One of this is our first fill consultation. So for members on certain medications for certain more complex chronic diseases where these conditions tend to stick around with you for a while and therefore those medications tend to stick around with you for a while, we do contact you soon after, maybe a few weeks after you've first filled a specific medication to try to just check in with you, see how things are going, see if you've run into any unexpected side effects or problems with the medications, and order some counseling, tips, and education on both the medication and the disease state. Our goal here is to catch you kind of more on the front end. That way, we can address any problems or questions that maybe your provider didn't have time to get to or might have forgotten to mention, before you've been taking the medication for a long time. We are always here to provide drug information and drug education. We really don't want to tell you what to do. We want to tell you why. We want you to be empowered to take control of your own health and to understand why you're doing what you're supposed to do. And we want to identify any obstacles. Of course, if we're not being consistent with taking our medications, we're not really optimizing their purpose or our therapy. So we are here to identify obstacles and also to work through them to find solutions. All right, so this is my favorite slide of the whole presentation because I feel that this quote just embodies ICUBAcares so well. It's a quote by Theodore Roosevelt, and it says, "People don't care how much you know until they know how much you care." And I really do feel that we are knowledgeable on the information that we provide, but that is not what we're most proud of. We're really most proud of how much we care. And if you have one thing without the other, it's pretty useless. So we do know what we are advising you on, but more importantly, we really do care about finding you solutions. And then some fun statistics here, and these numbers are actually a little higher than what they state here because we were around prior to 2020. We just weren't collecting data. And I think these figures haven't been updated in about 2 months. So the figures are going to be a little higher than what's shown here. But to date, we have helped 287 members with prior authorizations. We've helped just under 900 members with benefits and prescription processing and copay concerns. And we've engaged 6,396 plus members for medication checkups and or drug information counseling. Did I just skip ahead again? No. Okay. Just making sure. Okay, my second favorite part is just to provide a couple brief testimonials. These are some real ICUBA members who we have been able to help. Of course, all personal information has been removed, but we did have one ICUBA member who was on a high cost brand medication. This was covered through our plan for quite some time, but our plan changed. And in order for the member to continue on this medication through our plan, it would have cost her $22,819 per year, which is obviously not affordable. Our pharmacists were able to find a pharmacy contracted with the manufacturer directly to dispense this to her for $125 for a 3-month supply. We had another member who called because their child's medicated patch that was just applied the previous day fell off while out of town. They went to the local pharmacy, and the pharmacy said, well, we tried processing it, but it was just picked up. So it's too soon to fill, and they didn't really provide any guidance or recommendation on what to do. They called us, and we were able to work with OptumRx to put an urgent override in place. It went through that day. The child was able to get a new patch dispensed, and the family was able to continue with their vacation worry-free. We also had another member who was denied an authorization for a medication. She explained to us that she had tried everything under the sun, so she really didn't know, what to do from here now that her authorization was denied. We looked at the authorization on her file and noticed that the provider did not include any past therapies tried. So in the insurance's eyes, there was essentially no history of trying alternative products. We worked with their provider to update the request and properly document what she had tried and failed in the past. And once that was done, the medication was quickly approved. And lastly, we have advocated for many members with unique needs. We have all different members with different levels of abilities or various limitations, and we do provide guidance to the plan on those individual situations. I think if we are a living, breathing human in 2025, we can all agree that we get way too many phone calls and there's a lot of hesitancy even answering the phone when you see an unrecognized number. We really do try to respect your time and not outreach you and to outreach you only for a handful of reasons, all of which I have talked about. So for time's sake, I won't mention them, but we try to limit our calls to you. I did put our 1877 number down on the slide here. Feel free to save it to your phone so you are aware that it is ICUBAcares calling. Someone had the question earlier if it's going to show as ICUBAcares on your phone. It is supposed to, but I find that really varies by carrier, an individual. So go ahead and save the number to your phone so you know that it's us calling. And when might you call us? The answer is whenever you feel stuck with any type of progress, whenever you need some drug information or education related to your prescriptions, or if you have a unique situation, maybe you're traveling and you're going to need an extra supply of medication. Maybe you lost your medication. Maybe, God forbid, there was a hurricane or a flood or a house fire and you lost your medication that way. Go ahead and give us a call and we'll try to accommodate your situation. We are here Monday through Friday, 9 to 5. We do break for lunch from 12 to 1. But other than that, we are here and we will answer. The only reason we wouldn't pick up the phone is if we are on the phone with another member, in which case just leave us a message and we'll call you back. You're not going to be transferred 7 times, put on hold for an hour, just to get back to where you started. You will reach one of us directly. And our phone number is also on the back of your Blue Cross Blue Shield card, so you can always reference us there under ICUBAcares. So I want to thank you so much for joining us today. I really hope that you learned some information that you will take with you. And I encourage you, if you have any colleagues or friends that weren't able to join, go ahead and share the information and pass it along. Thank you so much.
Thank you.
Thank you so much, Stephanie. We appreciate you joining us
Yes.
today. It was a beautiful presentation. And for those, just a side note, please, please, please utilize ICUBAcares because they really absolutely do care. They absolutely do try to find viable solutions when you feel like you've hit a roadblock with trying to get medications. So just as a question, as a concern, if you have anything that you're concerned about with regard to your medications, yes, it is absolutely best for you to reach out to them directly, give them a call on the number, and they will give you as much help as they possibly can. Thank you guys so much for joining us today. We appreciate so much that we have gotten such a good response to these webinars. So we thank you for joining us. We hope you have an absolutely fantastic afternoon and be well. Thank you.
Latrice, this is Julie. Can I ask a quick question?
Absolutely.
Thanks. And this was a great presentation, Stephanie. I do see the phone number. This is just about the phone number on the back, the ICUBAcares.
Sure.
Below it, it says Pharmacy Help Desk. What is that? And that's different?
Yes, that's such a good question. So the pharmacy help desk will, if you call that number, you will get OptumRx.
Ah,
They
okay.
are, they're great, but I would say call us first. Call us
Gotcha. Will
first.
do.
You'll get us quicker, and we can probably help you a little quicker.
Got it. Thank you so much.
Sure.
Thank you. Any last minute takers on a question while we're still here? Feel free. What is the name of the app? RxSS.
Yes, so that is the name. If you're not finding it in the App Store, let me double check. It should be listed just like that, but let me double check on my own. And I can, is it a person in particular? Are you having trouble finding it? Have you already searched the App Store?
Yes, that's it. They did RxSS. Yes, that is correct.
And they can't find it under that?
Now, yeah, she was confirming
Okay.
RxSS.
Yes, yes. A lot of, I
Question
know, a
mark.
lot of X's and S's. Yes, that is it.
Okay, app name RX Saving Solutions.
Yes.
Thank you, David. All right. Thanks, everybody. Y'all have a great day.
Thank you, Latrice.
Thank you.